Did you know that sickle cell disease affects millions of people worldwide, but it primarily occurs in those of African, Mediterranean, and Indian descent? This genetic condition actually offers some resistance to malaria. Sickle cell disease is a genetic blood disorder that affects the production of hemoglobin, a vital protein in our red blood cells. It's a chronic condition that requires lifelong medical care, and it's more common in certain ethnic groups. The disease is caused by a mutation in the HBB gene, which codes for hemoglobin. This mutation leads to the production of abnormal hemoglobin, known as sickle hemoglobin, which causes red blood cells to become rigid and sickle-shaped. As a result, these abnormal red blood cells can get stuck in small blood vessels, blocking the flow of oxygen to various parts of the body, leading to severe pain crises and other serious complications. Imagine living with a condition that causes recurring episodes of excruciating pain, often requiring hospitalization and disrupting daily life. Individuals with sickle cell disease often face a multitude of challenges, ranging from painful crises to chronic fatigue, and from jaundice to delayed growth and development. Painful crises can be triggered by various factors, including dehydration, temperature changes, and stressful events. These crises can be so severe that they require immediate medical attention, and frequent hospitalizations can lead to a significant burden on the patient and their caregivers. Sickle cell disease can also lead to an increased risk of infections, particularly in the lungs, bones, and joints. Patients often experience chronic fatigue, which can affect their ability to perform daily tasks and maintain a regular routine. Jaundice, a yellowing of the skin and eyes, is another common symptom, resulting from the rapid breakdown of red blood cells. Additionally, sickle cell disease can cause delayed growth and development in children, as well as cognitive impairment and mood disorders. In some cases, it can even lead to life-threatening complications, such as stroke, acute chest syndrome, and organ damage. Despite these challenges, with proper medical care and management, many people with sickle cell disease can lead active and fulfilling lives. So, what exactly happens in the body of someone with sickle cell disease? To understand this, we need to dive into the biology behind the disease. Normally, red blood cells are flexible and disc-shaped, allowing them to move easily through narrow blood vessels. However, in sickle cell disease, the abnormal hemoglobin causes the red blood cells to become rigid and sickle-shaped. These sickle-shaped cells get stuck in small blood vessels, blocking the flow of oxygen to various parts of the body. This can lead to tissue damage, organ damage, and even organ failure. The genetic basis of sickle cell disease lies in the mutation of the HBB gene, which codes for hemoglobin. This mutation is usually inherited from one's parents, and it affects the production of hemoglobin, leading to the abnormal sickle hemoglobin. The symptoms of sickle cell disease vary widely, ranging from mild to severe. Some patients may experience frequent pain crises, while others may have fewer complications. The severity of the disease depends on the individual's genotype, as well as various environmental and lifestyle factors. Symptoms can include anemia, fatigue, jaundice, and shortness of breath, among others. In recent years, there have been significant advancements in the treatment of sickle cell disease. Gene therapy, for instance, has shown promising results in reversing the symptoms of the disease. Other treatments, such as hydroxyurea, have been effective in reducing the frequency of painful crises. Pain management strategies, such as opioid therapy, have also improved the quality of life for many patients. In addition, various medical procedures, such as blood transfusions and bone marrow transplants, can help alleviate the symptoms of the disease. Despite these advancements, more research is needed to develop a cure for sickle cell disease. However, with continued awareness and education, we can improve the lives of those affected by this condition. In summary, sickle cell disease is a complex genetic condition that affects millions of people worldwide. It's a chronic condition that requires lifelong medical care, and it's essential to raise awareness and understanding of this disease. Thanks for watching. If you have any questions or personal experiences you'd like to share, please leave them in the comments below. Don't forget to subscribe for more informative content on health and wellness, and check out our other video on blood disorders.